Hey, I just wanted to give a quick update on how my surgery went. I know that some people are still like looking for answers and suffering themselves, so I wanted to answer that real quick. But as far as like all the details of recovery and everything else, I'll make a video later about that. Just like a quick overview, it's been 2.5 years since I had the surgery, and the quality of my life has drastically improved. Like right before I had surgery, the last 2 weeks got really bad. Warning, this is gross, but I was gonna go like trying to throw up, like I needed to throw up, but I couldn't. Like I was so paralyzed that I couldn't get the throw up out, and my husband and my mom had to like flip me over and hold me over because I was choking. I also had a really hard time breathing. At one point we had to call the ambulance because I was couldn't breathe. When they came, by the time I was able to communicate like that I was not breathing, it was just hypoxic. So luckily I never like went blue or anything, but I was definitely struggling getting enough air. And then we were able to treat the seizures enough with medication that I was able to board the plane and get through security. I still had seizures on the plane, but luckily was able to like get through that crucial part. After the surgery, I was sore for a long time, had some impaired judgment, which I mentioned for this next part. Talking about it makes me feel like an idiot in retrospection, but I had been working on training. Like I bought a horse right prior to surgery when all the doctors didn't know what was going on and just told me I was losing my mind. And so I started training him, but then found out I had to have neck and braid surgery, was going paralyzed, had somebody take care of him. After surgery, I wasn't cleared to ride for a year, but about 4 months in, I decided to hop on him anyways and was really dumb, and I didn't wear a helmet, and he like reared up and I fell on the ground and hit my head. Had a concussion, but like my fusion was completely fine. Later, when I was cleared, I was wearing a helmet and I came off again. After those things, there was one more time that I rode him and I came off and I broke my pelvis. I mention all of this to say that I had like 3 significant head traumas in the year after surgery, like I guess the year and 3 months. And so I just wanted to mention that to say that a lot of other methods of the fusion would not have held up and I would have had surgery again. Granted, that was a really poor choice, but I did notice that it wasn't just that. Like I had about a year of pretty like impaired judgment, which I found out later is pretty normal. But now I am a lot smarter, okay, making better choices. But now like I've been able to hold down a job, which I've never been able to do because I would just have seizures or paralysis attacks or narcolepsy attacks so bad that I couldn't do with that. And I, obviously still have EDS, and so I will deal with subluxation still. As far as like my neck, the C3 still goes out a lot, but it doesn't affect like my breathing or paralysis or anything like that. And so I just go to a chiropractor and they adjust that, and my occiput will sometimes go displaced, and luckily they're able to adjust both of those things. The chiropractor I used was actually referred me to the neurosurgeon, which is impressive because they're, very different sides of the country. As far as like the success, it's not only saved my life, but I am healthier than I've ever been, probably since I was 16 years old. I'm able to be way more active. Still, after surgery was dealing with some seizures, so I got an anti-seizure medication. I also discovered that having like collapsing attacks is part of having POTS, and I do have POTS, and it is pretty common with Ehlers-Danlos syndrome. POTS stands for postural orthostatic tachycardia. I would go from laying down with my heart rate being at like 80 beats per minute and then go to standing up right around then my heart rate jumped to 155 beats per minute. And so now I constantly, other than sleeping, am always wearing compression leggings, and that has mostly fixed that portion. I don't like have collapsing attacks or anything with that. And so surgery of course hasn't fixed my chronic illnesses. Like I still have narcolepsy, I still have Ehlers-Danlos syndrome, and I still have POTS, but I am able to function, to be a present mother. I do deal with significantly like less pain, less brain fog, far less seizures, even, without having taken the anti-seizure medication for a while and without addressing the POTS, I still had a significant decrease in seizures. But now treating those things, they happen rarely. I am able to like play at the park and do fun things. I haven't had any like lasting paralysis. I have a little bit sometimes, but that's more due to the narcolepsy and just like sleep paralysis. Yeah, I mean, everything's just better. I am able to function basically like a normal person most of the time. I manage the chronic illness stuff a lot better now because I am able to like sit upright and not pass out, and everything's improved a ton. Right before surgery, I was having a lot of really like what I would call near-death experiences. There was a point where like a week before surgery, I definitely felt like I had like 2 weeks left to live. And for a moment, we thought we'd have to like postpone surgery. And I was just like, I won't make it. Like, I don't know how to describe it other than to say like that whole experience of having, life flash before your eyes and knowing every tiny little regret happened. But also like, I just felt like I had an expiration date. And because of surgery, I'm able to be alive and to watch my children grow up and to function better than I ever have. And there's no like way to express that better than I'm extremely grateful to be where I'm at and to have had this option. Having done a lot of research, a lot of the other fusions fail even without having had head trauma. And since I did, which granted, I know it's really stupid, okay? But since I did have head trauma, and they didn't fail, like the success rate was extremely good. Now that I have better judgment, I make better life choices. Want to say that there's a huge improvement to the quality of my life and to being able to be a present mother in life. I know this update should have come a lot sooner, but frankly, I kind of like just dissociated from the whole experience and just wanted to live life and heal and get a little better. I just really wasn't feeling up for talking about it for a long time just because it was so consuming and emotional. I'm able to just do like normal life things, like have a part-time job. I'm able to, take care of my kids and the yard and the house and, make food, like all those normal things that I was so far from being able to do. Just the mental clarity has massively improved. I don't know, just everything is a million times better. If you do need a neck fusion and have Ehlers-Danlos syndrome especially, I highly recommend this. Obviously, it depends on the person and your circumstances, but it has improved all areas of my life and legitimately saved my life. It was definitely a matter of time of when I would die, not a matter of if at that point. Like even all the doctors concluded that there was no other option and that if I didn't treat it, I would die. And it would have been pretty quickly. Doctors discovered when I had done the surgery that we were more at like 10.5 to 11 millimeters of off. And I think like the world record is 11.5 to 12. And that person was treated by a different doctor and still remained like paralyzed from the waist down. And so the fact that mine was so bad and had such a high success rate truly is like one credit to the man that spent his whole life doing this and researching it and able to perform the surgery, but also truly a miracle. And I am extremely grateful for all the support that I've had through this process, all of the financial support to be able to make that possible, because we just wouldn't have been able to do it at the end of the day without it being covered insurance and being $100,000. There was just no way we could have done it. It took us a while for our house to get qualified for a second mortgage, and so thanks to everybody's help and like loans we got from family members and things like that, we were able to pay it until we were able to finance some of that ourselves as well. I wanted to update in case you are looking into surgery. I had this surgery in Florida. I will like list that below. Again, I mean, do your own research and make sure that it fits for you. I don't think I mentioned in my fundraising video, but I did have a decompression of my cerebellum as well. And so they had found out that it dropped. And so that is, again, a normal part of Ehlers-Danlos syndrome. When that's affected, when your neck is affected, that often is. So they were able to relieve the pressure off of my cerebellum and then grind up the bone and use that as part of the graft. And so because it was my own bone and wasn't a donor, then that graft, I think, helped a lot more. The surgeon just said that my body would take it a lot better. So all of those are things that I just wanted to mention because I think that if you're looking into it, you know, I would have appreciated this information myself much sooner. So I apologize for not having given it sooner. Yeah, I just wanted to share that, and I appreciate you guys staying through my journey and everything that has followed, and I'm grateful to have the life that I have now because it's very different. I often felt like a failure or that I was lazy prior to the point where it got really acute. I was so poor functioning and would just lose energy so quickly. And, you know, I knew I had a lot of chronic illnesses, but I just thought like it was a failure in myself. And I think that's kind of easy to do when you deal with chronic pain and like such poor energy. But having recovered, like, I know that I'm not lazy, right? And even though I feel like I kind of cognitively knew that, I just compared myself to people that were healthy. And even though I still have several chronic illnesses, I am able to manage those all and able to just function. You know, if you are dealing with this, just give yourself some grace, I guess, and look for the resources and teams that can help you through that process. Like, as much as it sucks, not every doctor is going to refer you or see if you need this type of treatment. You know, I spent many years dealing with the symptoms of cervical instability, and the conclusion was always just like, it's trauma, or you have a lot of, you know, PTSD type symptoms, which I did, but that was separate. And had I not like done the research myself and found the problem myself, and then found a doctor to conclude that information, and then found a good doctor through more research and recommendations to treat it in the way that I needed, like, my story would have ended very differently. As much as you know, want to find a really good team that can help you, even just like if you can read research papers yourself and advocate for yourself, that's a huge benefit. I was able to just have a lot of success with the support around me and with the help of friends and family, neighbors, strangers, and also able to now live a functioning life thanks to all of those things. And so I hope that this helps you in your journey if you're struggling with it personally. It shows my appreciation for everything that has been done. So I hope you guys have a great day, and yeah, I'll try to send all of that updated information, journey, how long everything took healing, and pictures and just the whole process. But I just want to give you this quick update. Okay.